Thank you. The last presentation actually reminded me of so many stories from my own experiences living in India when I was in high school and also in Senegal. But it also reminded me of a story that Dr. Salim Jahan of UNDP had told me a couple months ago, and he was telling me that when he was in Alexandria, Egypt, he had gone up to a group of young people and asked them whether they could even sign their own name because they were illiterate. And he started sort of really getting on their case and saying that you need to take advantage of educational opportunities, and how are you ever going to find a job in today's world without going to school? And so the group of boys, they grabbed his cell phone from him and they disabled it and they handed it back to him and they said, how are you going to find a job in the 21st century world if you can't even figure out how to operate your own phone? And that's sort of, to a certain extent, part of the theme of my presentation is that young people have certain skills as digital natives that I've watched many older generations struggle to acquire, and so I'm going to try to make the case that as young people, especially those of you in the audience from Tufts, that we do have abilities that we can contribute in the area of global health and the environment. Just briefly, I would like to thank the Tufts University of Engineering for School of Engineering for having me here and all of its collaborators, and also to thank the US State Department for taking the leap of faith of creating this role at the United Nations. It truly was a leap of faith to select me for this role. And serving as the first ever US Youth Delegate at the UN has been truly an unprecedented opportunity to engage young people in diplomacy and development. As was mentioned, a significant part of my role involves working with young people across the US and abroad to encourage them to become more involved in the work of the UN, and also, to a greater extent, just to encourage them to become involved in their own communities at the grassroots level. And in addition to working with US youth, I also work with the other 40 youth delegates at the UN from countries as wide-ranging as Kenya, Thailand, Turkey, and Germany to ensure that youth voices and priorities are better incorporated into the work of the UN. I think all the young people in the audience today understand this, but truly in today's world, there's no challenge greater than creating economic, social, and political opportunities for young people. Based on global demographic shifts, global youth now possess greater potential to drive economic, social progress, but also to threaten regional stability and security. In the Middle East and North Africa, the region that I'm most familiar with, and of course one of the most volatile regions in the world, young people ages 15 to 29 constitute 1/3 of the region's population, representing the second largest youth bulge in the world after sub-Saharan Africa. Last year, the world's population surpassed 7 billion people, more than half of which are under 30. Those of you that have been at the UN know that more than half of the people in the UN are not under 30. This youthful demographic landscape must be a central part of any development program or policy, especially in the area of global health and the environment. Young people are both today's and tomorrow's wage earners and entrepreneurs, educators and innovators, health professionals, political and civic leaders, and are vital to economic growth and well-being. Also, as we heard in the last presentation, globalization, technological advances, and the spread of social networking offer new opportunities for young people around the world to connect and become more active participants and beneficiaries of development. In its 2007 World Development Report, the World Bank suggested that developing countries which invest in better education, healthcare, and job training for their record numbers of young people could take advantage of what has been deemed the demographic dividend to accelerate economic growth and sharply reduce poverty. But as we know, there's nothing inevitable or automatic about achieving the promise of the demographic dividend. Young people must be given the skills, resources, and opportunities to succeed. If so, young people can be among the strongest proponents of stable democracies, vibrant societies, and prosperous economies. Last month, I had the privilege of spending a week at the United Nations in Geneva with the 2013 Internet Freedom Fellows Program. The Internet Freedom Fellows Program, an initiative of the US Mission in Geneva, brings together human rights and digital activists from across the globe to Geneva to discuss the role of technology in promoting human rights. One of the young activists, who wanted to be known only by the name Mac Jordan, has used his skills in mobile technology to create apps to improve access to affordable health information in his home country of Ghana. For example, he's helped to develop mobile apps for pregnant women in local languages to facilitate better information dissemination to rural areas where access to quality medical health information is extraordinarily scarce, and to improve operational efficiency at community health centers. I remember in my own experience living in India that often I would visit villages where young people they were more likely to have cell phones than access to a toilet. From banking to agriculture, mobile technology plays a vital role in the life of the average Ghanaian. In Ghana, the Grameen Foundation is developing and distributing mobile phone-based apps to help the poor better manage their health through such programs as the Mobile Technology for Community Health Initiative. Closer to home, which in my case is Chestnut Hill, I recently met with 2 US-based organizations led by young people that are working to find creative solutions to global health challenges facing youth. We are all familiar with the startling statistics about youth health. More than 2.6 million young people ages 10 to 24 die each year, mostly due to preventable causes. We also know that promoting healthy practices during adolescence and taking steps to better protect young people from health risks is critical to the prevention of health problems in adulthood and to the future of national healthcare systems. The first organization that I would like to speak about is Girl Up, an innovative campaign funded by the UN Foundation to address the health and educational needs of adolescent girls in developing countries. The campaign mobilizes American girls, both off and online, to raise awareness and funds for programs of the UN that help some of the world's most difficult to reach girls in countries like Liberia and Malawi. Addressing the needs and rights of women and girls is essential to alleviating poverty, stabilizing the world's population, and accelerating progress on the global development goals. In the area of health, Girl Up is pioneering a girl-to-girl model of disseminating health information, both off and online, training young girls to spread awareness to their female peers about sexual and reproductive health. Medical complications from pregnancy and childbirth are still the leading cause of girls around the world, ages 15 to 19. And in sub-Saharan Africa, as we just heard, 75% of HIV-infected youth between the ages of 15 and 24 are girls. Another organization founded by students at Harvard and Yale is the Acolyte Initiative, a youth-for-youth movement that seeks to build the next generation of leaders in global health while providing under-resourced global health organizations with cutting-edge tools and resources. The idea for Acolyte was born during the summer of 2010, when 2 college students working in Ghana and Bangladesh on similar projects realized how useful it had been for them to share ideas and best practices while tackling challenging work for under-resourced health organizations. Recognizing the need for better preparation and training for students working on global health, and I'm sure many of you students can relate to this, they launched Acolyte in the spring of 2011. So far, Acolyte has focused on connecting young people and publishing youth work and ideas in global health online. They have thousands of social media followers and an extensive network of involved students spanning the farthest reaches of the globe. Recently, they've also launched a social enterprise that trains students to provide consulting services in advocacy, social media, and technology for global health organizations. So far, their consulting services have helped launch a social media campaign on road traffic injury with the Tanzanian government, served as the youth arm for communications and outreach for the UN Special Envoy on Malaria Initiative, and created a video campaign and smartphone app to combat distracted and drunk driving, all in less than a year and a half. All of these examples, of which I could share countless more, are tangible demonstrations of the widespread impact young people can have on the future of world health and the environment. At universities such as the one we are privileged to gather at today, young people are contributing to the field of global health and the environment by sharing their work, ideas, and resources across university and even country boundaries. The increasing involvement of diplomats in health issues and of health experts in foreign policy demands the creation of new opportunities for young people to become engaged in global health diplomacy and governance. A positive example of such an opportunity is the Youth Pre-World Health Assembly, which will be held between May 16th and May 20th in Geneva next month. And the Youth Pre-World Health Assembly will bring together young people from around the world in a 3-day workshop on global health diplomacy and governance. The aim of the conference is to educate and empower future leaders in health with enhanced knowledge and understanding of global health issues. The primary end goal of the event is to develop a streamlined plan of action for youth participation at the World Health Assembly, and participants will work together in small groups to develop a comprehensive plan of action to create a more effective and meaningful youth participation at the World Health Assembly. Finally, the participants will have the opportunity to attend the World Health Organization's World Health Assembly and carry out joint action with the other youth delegates to make their voices heard and have a greater impact on global health. We need more opportunities like the Youth Pre-World Health Assembly to increase the visibility and impact of youth participation and collaboration on global health. Fortunately, I'm pleased to report that there is a growing support amongst member states at the United Nations for engaging youth in development, implementation, and evaluation of national youth health policies. For example, the UN resolution on promoting youth participation in social and economic development urges member states to involve young people and youth-led organizations in the development of national policies designed to meet national youth goals and targets. The resolution also urges member states to ensure that young people are recognized as active agents in decision-making processes and for positive change and development in societies. One example of this is national youth councils, or their equivalent bodies, are one of the most effective channels of cooperation and information exchange between young people, their national governments, and other decision makers. The U.S. Department of State's Office of Global Youth Issues, which I work very closely with, currently operates 50 youth councils worldwide in order to support youth-driven solutions to the world's most pressing problems. Strong youth councils can provide opportunities for more young people to become active in decision-making and in shaping their societies. In May 2011, the World Health Organization passed its first youth resolution since 1989, focusing on youth and health risks. The resolution calls upon UN member states to facilitate youth participation, collect data, review policies and strategies, provide sexual and reproductive health services, and to ensure multi-sectoral collaboration, among other goals. One of the most exciting developments in the US of the State Department impacting youth health and the environment was the unveiling of USAID's first ever policy on youth and development in October 2012. For those of you that are familiar with USAID, you might be surprised to hear that this is the first time that they're unveiling youth policy, because USAID has worked with youth for a very long time, but this is the first time that they've actually created a concrete policy about how they're going to engage with young people. This policy lays out specific strategies and guiding principles for how we as a country ought to invest in the world's young people over the coming years. Some examples of promising cross-sector collaboration outlined in the policy, all of which you can access online, include the expansion or creation of peer sexuality education programs and youth-friendly reproductive health services, youth livelihood programs targeted to youth at risk for HIV, agricultural programs that coordinate with nutrition, technology, women's empowerment, and environmental programs, the creation of safe spaces that provide informal education, health guidance, and computer access for at-risk youth, and sports programs for leadership, reconciliation, and health. This exciting and new policy challenges USAID to integrate and mainstream critical priorities concerning youth across its programming. USAID currently has no formal structure or agency-wide funding source for youth and development, and it has been a challenge, frankly, to mainstream, integrate, and coordinate youth activities across the departments. I would like to conclude my remarks with saying that the world at this stage really stands at a crossroads. While there are more young people in the world than ever before, today's young people face an opportunity divide, a gap between those like us who have the access, skills, and opportunities to be successful, and those who do not. Yet closing this opportunity divide is one of the most important actions we can take to secure the future of world health and the environment. I challenge every one of you in this room, including the students, to continue to engage young people in imagining and realizing their full potential by connecting them with greater education, employment, and entrepreneurship opportunities in your respective fields. I will be doing this this week. On Thursday afternoon, I will be speaking in the UN General Assembly to 2,000 middle school students who are there for the International Model UN Conference. And I assure you that will be a challenge, commanding their attention. Youth need your support, they need your encouragement, and most of all, your access to achieve their full potential and to overcome their self-doubts. Given the opportunity and preparation, youth are valuable partners who can offer assistance, guidance, innovative thinking, and solution. I emphasize partners because I think oftentimes youth are seen solely as the beneficiaries of programs, when really they can be engaged as a part of the solution. Young people also know how to reach other youth in ways that can improve knowledge, shift attitudes, and ultimately change behavior, which is why I'm so excited about the organizations that are pioneering a youth-to-youth information model. Most importantly, youth participation in development promotes a more positive image of youth in the wider community, transforming the perception of young people as a part of the problem to a part of the solution. Thank you.
Well, I've had the opportunity as a representative of the Tufts Institute of the Environment to work with the U.S. State Department on the U.S. Water Partnership. One of the things that is evident is we need to have a more effective message and story be told about issues around water. And based on Ms. Loughrin's presentation today, I think you should be hired as the spokesperson for that message. It was a wonderful talk. What we'd like to do is we've recovered in our time. We have about 5 minutes left before our poster session, which will be held in Balch, and then we will come back into the hall to hear our keynote at 11:30. With that in mind, I'm wondering if any members of the audience would like to go to that microphone over there, the one on the left-hand side, state their name, and a brief question for one of our 3 speakers who then could reply with this microphone here rather than ascending the steps in serial fashion. So if there are some questions from the audience, if you could make your way to the left-hand side microphone. And we could also have panelists ask questions of one another if they'd like. That's another way we could get questions. There's so many professors in the room. Hopefully, we're not going to just leave it to the students. Any takers? Well, it seems that people are quite interested in attending the poster session then, where you'll be able to read and converse with people who are actually doing the work, and it's always exciting for that to happen. So our poster session will be, and also our speakers, I think, will all be at the poster session, so that you'll be able to ask questions in a less intimidating environment than an open microphone. I'd like to acknowledge the generous participation and support of our colleagues from the Tufts School of Engineering, the Tufts Graduate School of Arts and Sciences, and the Tufts Institute for the Environment, all of whom have produced posters that you're about to witness. I'll remind you that we will break promptly at 11:30. Return to this hall. We are going to go now to Balch Arena, where you picked up your credentials for today's meeting and your tickets, that kind of thing. So we're going to take a break now, walk over to Balch, and you'll be able to obtain some refreshment, coffee and drinks, that type of thing. Coming back refreshed at 11:30 for Dr. Ergeroff and the keynote presentation. So thank you very much for your attention this morning. You've been a very good audience. The panelists were all great. One more final round of applause for our speakers. Thank you very much.